Of course, one of the lasting memories of lockdown is Clap for Carers, the weekly celebration of those working in the NHS and the care sector. Now, the first ever clap took place 5 years ago today. Camille Leavold runs Hertfordshire-based home care provider Abbott's Care and was the first recipient of the new Chief Nurse for Adult Social Care Award. Earlier, I asked her how much the recognition meant.
For us, as a sector, it was amazing to get that recognition and to get that appreciation. We had care workers out and about in our communities that we serve, and people were going up to them and thanking them. You know, as they were driving down the road, people were like clapping them. So yeah, it was very uplifting. It was great for our workforce. They actually felt seen and they actually felt respected for once.
Now, we're 5 years down the line. Has that left any kind of a legacy?
I'd really love to say it has, but you know what has happened is on the 5 years, so it's like the clapping is now a very distant sound. We've had the second government since then that's promised to fix social care. This government promised to fix social care before they came in, but unfortunately they've also, kicked that can down the alley, so it's not going to be till 2028. And even more so, they have actually penalised social care even more with the employer NIC that's just coming in. So no, we don't feel recognised, we don't feel heard, and we don't feel the part we play in our communities is valued in the same way that other services like the NHS are.
And how does that leave you feeling then? You must be quite disappointed by that.
We're used to it in social care, in home care. We're used to it. We are like the Cinderella service, if you like. Not that I feel we are, but it's kind of like we're a bit of an afterthought. And we're used to the challenges. I mean, we face huge challenges every day. We have 600 staff, care workers that we have to get to 1,500 people's homes every single day. It's a massive challenge. So we're used to the challenge, but I think. I've actually just been with some colleagues today, some CEOs of other home care providers, and we know there's going to be some failures this year. People can't shoulder the increase in the NIC, and unfortunately, local government can't shoulder it either.
Now, if you could take something from those Clap for Carers evenings and the atmosphere and the support that was shown for the care industry, for the NHS, and bring that forward to now, what would you choose as that legacy?
I think the recognition. I think for most of it, people don't do this job, don't do care work just for the money. We do it because we love what we do. We love helping people, making a difference to people's lives. So just to get that recognition for the care workers, for the teams to be like, for them to feel appreciated. And obviously money is important. Obviously everybody works for money, but actually that alongside a fair pay from local authorities to providers to pay the care workers would be amazing. And also for some recognition of their contribution to COVID, of what they actually did, would also have been brilliant, because it's a really valuable role we play in our communities.
Camille, thank you for joining us.